Technical Director of the Epidemiology Division at the Ministry of Health, Dr. Avery Hinds, has refuted a newspaper report insinuating that COVID-19 was in this country prior to March this year. He said the report did not properly analyze the data nor use it appropriately. WASON has more.
It was this report in the Guardian newspaper that drew a response from the Technical Director of the Epidemiology Division at the Ministry of Health, Dr. Avery Hinds. The report attempted to convince its readers that COVID-19 could have been here in this country long before March, when the first COVID-19 case was reported. According to Dr. Hinds, the data in the report was improperly used. The report cited a high number of respiratory deaths between December last year and March this year, implying that COVID-19 was here prior to March. The report, however, did not include a comparison of corresponding periods from different years. The report also did not take into consideration the underlying cause of deaths. The report was done by a layman and needed the input of an expert.
With the hypertension figures in particular and the diabetes figures, we recognize that the overlap where one person may have both hypertension and diabetes, that wasn't acknowledged. So you have double counting of the people that have both hypertension and diabetes in the figures presented.
According to Dr. Hinds, the figures would have been different if COVID-19 was really here during the period that the report tried to suggest.
If the virus was in the population for the length of time that has been suggested or alluded to, then a much different epidemiologic picture would currently be seen in the population. Many more deaths, hospitals would already be full.
He said all information presented by the Ministry of Health are validated.
One does not simply splash raw mortality data across a newspaper page. We present information in a context, and we will continue to do so, and we'd like to ask you to continue to trust the information that is being provided as we do it to an international standard.
Dr. Hinds assured the public can trust the information disseminated by the Ministry of Health. WASON, TTT News.